It all comes down to why in the world is really the question we should be asking. Why in the world are our costs of education going up, incomes, relative incomes for allied health professions staying the same or sometimes going down, and what can we do about it? Hey everybody, Rafi Salzar here with the Better Outcomes Show, and we want to talk about the Department of Education, loan limits, the crisis of student loan debt for healthcare professionals, and whether or not this proposed rule from 2026, the healthcare professions, allied health care professions like nursing, physical therapy, occupational therapy, reclassifies them as graduate degrees instead of professional degrees, if that's really something that is going to be bad for the profession, or if it really just sheds light on a bigger underlying problems. Let's dive right in. I first became aware of this, I think everybody did, at the tail end of 2025. And at the time, I had put a pin in it. I'd actually recorded some of a podcast, but it was kind of early on. I was like, well, let's kind of see what happens and kind of the reasoning and what goes on and kind of what the Department of Education says about the student loans and their programs and why they're going about reclassifying it. So I put that one on the back burner, and it's been a few months now. It looks like the DOE is still moving forward with reclassifying a whole bunch of degrees as what they consider graduate degrees instead of, I guess, professional degrees. So professional and graduate. What's the big deal? I think a lot of people, first when it came out, were very offended. It was an emotional response. How dare they classify my degree as a graduate degree and not a professional degree? It's a professional. I'm in a professional degree. I have a professional license, et cetera, et cetera. And then once the dust settled from that, people realized, well, that was not really the issue. The underlying issue, or the internal classification system, because that's what it is essentially, that the Department of Education was using, really meant or designated how much students in various degree programs could borrow from the federal government for subsidized student loans. And I think I've got the numbers here for those numbers, or for the differences. For a professional degree, so the higher one, as Department of Education is calling it, the current draft rule, now this is 2026, I'm hoping that this conversation is really going to be much more broad and high level, consider it evergreen if you would. I don't want to focus on this specific rule, but I'm going to give a little bit of context about it to really shed light on a bigger issue in my mind. So under the 2026 rule, professional degrees, or degrees that are designated as professional, the students in those programs are eligible for higher federal loan limits. So it's up to $50,000 per year and $200,000 total or lifetime. If the program is designated as a graduate degree or graduate program, the students in those programs are eligible for about half. It's about $20,500 per year with a $100,000 lifetime cap. So currently, as the last list I saw, which was the other day, nursing, physical therapy, occupational therapy, physician assistant, some public health degrees, social work, several other allied health programs were not included in the professional category. They were all put on this graduate program classification for the Department of Education. So I will start by saying, as I said months ago when we first got this news, the terminology is clumsy, for sure. I'll grant it that. I think what we need to do, though, is look at kind of the higher level, kind of what the Department of Education is trying to do with this classification system and putting limits on. From a policy standpoint, what does it mean? What it means is that, well, if your program isn't in the professional degree, you will be eligible for less student loans, or a lower balance, if you would, by the time you graduate, of student loans that are federally subsidized. It does not mean that you're not eligible for private funding, private lenders, and things like that, if that's something you choose to do. It just means the Department of Education isn't going to give you anything more than $100,000 for the lifetime of your student or your studies in that program. Why does that matter? Well, it matters for a couple of reasons. Much like I've mentioned with fee-for-service healthcare, when you are stuck in a situation where the costs are rising and rising and rising. In a fee-for-service model, payers, insurance companies, for example, only really have two levers to pull to remain solvent, right? They can limit the amount of healthcare they cover or pay less for that coverage, right? And that's how it works on the healthcare provider side. So insurance companies, because everybody's on fee-for-service, they say, well, we're going to put authorization limits in place or prior authorization requirements before you can see the beneficiaries for these services. We're going to try to pay less per unit or per visit or per encounter. And that's how we're going to limit the amount of spend in order so that we don't go out of business, essentially. The federal government, when it comes to student loans and student loan repayments, don't really have that option. It's not like they can go out and say, well, we're not going to pay for these degrees. I mean, I guess they could, but they're trying to balance their funds being dispersed with, equity and making sure that people that wouldn't otherwise have access to an education get access to higher ed through these subsidized programs. That was the original intent, right? The problem is that, especially at some of the graduate levels where you have elevated cost of participating or receiving those degrees, you end up falling into a real risk of students not being able to pay back those loans, either not being able to pay them back in a way that's financially feasible for the DOE and the national budget and stuff like that, but then also on their own quality of life and their own financial health going forward. I think some of those income determined repayment programs are 10 years or more of student loan repayments. And that's hoping that you end up getting forgiveness or something like that, which you end up needing to pay taxes on down the line, which we won't go into right now. But it's a very long, it's a long road if you have student loans for paying them back. And if some of these, I know when I was going through grad school, I think my interest rate on our student loans were like 6.8% or something like that. It was crazy high. I'm sure it's higher now. I haven't looked. Well, let's look right now. Just student loan interest rate today. Oh, so it's about the same. Direct unsubsidized for undergraduate is 6.39. For graduate degrees and professional degrees, it's 7.94%. So almost 8%. Of the balance, right? So it's 8% year over year, which is crazy high. It's higher than a mortgage, or at least standard mortgages. I think right now they're hovering. Right now it's like 5.5 to 6, somewhere in that neighborhood. So not quite double, but much higher, 40% higher at least than a mortgage. So what happens is you have all of these students getting professional or graduate degrees. They're going into graduate programs or graduate school and coming out with these master's degrees and doctorate degrees in a way or in some fields where they might not be able to pay those loans back reasonably. Because even if the government or the DOE grants you forgiveness, yeah, that's good for the student borrowing, the person who took out those loans, but it really damages the long-term financial solubility of a program meant to provide funding for education for those that don't have access, right? So if you're forgiving more loans than you're getting paid back, you're going to run out of money eventually, right? Or you have to raise taxes and all kinds of stuff. So that's kind of like the background, if you would. And I think what the federal government with the DOE is trying to do with this restructuring or reclassification of certain degrees is they're probably looking at things like earning potential of those degrees and whether or not it's responsible to saddle somebody with potentially 6 figures in debt for a degree where they won't be able to reasonably pay that off in a usual amount of time, in a way to keep the funding mechanism going without having to dip into greater and greater budgets, right? I think from an economic standpoint, it makes sense. I know I've talked about this before in the past. When I graduated in 2012, so this was years and years ago, I graduated with around $40,000 in student debt for a degree in which I was earning my first year, I think was something like $68,000 a year. So I was already graduating and getting a job where I was going to make more than in 1 year than I owed on the entire 5 years of my school. Now, Obviously, tuition has gone crazy high, and we'll talk about that in a minute. It's not the same economic environment as when I graduated in 2012. Now, I graduated high school into the Great Recession, 2007, 2008. While I was in school, undergrad and then graduate from 2007 through 2012. It took me 5 years to graduate. Can answer questions on that if you want to shoot me an email about how we did that. It was an entry-level master's program, essentially an entry-level graduate program. But anyways, so it was a different environment economically. I think if you adjust for inflation and all that, OTs and PTs and other allied health professionals aren't making much more today than they were back then. However, cost of living has gone up and tuition has gone through the roof. So the question then we should be asking is not, is it fair that the Department of Education is limiting how much they're going to subsidize or lend to certain degree programs? Or should the question we're asking be, why are programs becoming more financially costly versus an investment? We'll go into that in a minute. Why are they becoming more financially costly and yielding relatively little in the increase of ROI, if you would? Like I said, adjusting for inflation, entry-level allied health professionals aren't making much more than they were 13 years ago, 14 years ago when I graduated. However, the cost has gone substantially more. Let's look at, I'm going to Google this now. I should have come prepared. Rate increase between we'll just say 2010 or 2011, so we'll do 15 years, to 2026. So according to Gemini here, it looks like it has gone up. It has increased by over 35% since 2008. So I don't know why it went to 2008 and not all the way to 2011, but that's still, so it's gone up to 35% over 2008. And then inflation from 2008 to 2026. Let's see what that is. 2.4% per year, yada, yada, yada. So it's gone up, right? So inflation has gone up. So what we pay for things when we graduate has gone up significantly, 2.something% a year. What students are paying now for those degrees has gone up 35%. And the salary hasn't gone up all that much. So let's just look at inflation adjusted PT salary 2008 versus today. Let's see what it says. Okay. So the average salary for a physical therapist in 2008 was $71,000, which is about probably in the same income or same bracket as occupational therapy and maybe some other allied health professionals. I know, like I said, I was making around 68 as a new grad in 2012. About $1,000, give or take, was the average salary. And that was still a spread because you had some people that were making more, some people that were making less. Inflation adjusted value, to have the same purchasing power of the $71,000 in 2008, a PT would need to be earning around $107,000 in 2026, based on a cumulative inflation rate of over 50% during that period. I don't know about you. I do not know, and I run a clinic and we hire PTs and OTs. We do not pay that much. I know there's some home health companies that are paying around $100,000 a year. I know there's some hospitals where if you work the weekend shift, you're making about $50 an hour, give or take, maybe a little more, which is about $100,000, but it's still less than that 107, give or take, that you would need to maintain the same purchasing power of the inflation adjusted $71,000 of 2008. The tuition has gone up by 35%. And for the most part, on an inflation adjusted basis, physical and occupational therapists are making less now than they were from a purchasing power perspective than they were back in 2008. So it's actually been a negative ROI over the last, 20 years or something like that. Why does all of that matter? Because when the Department of Education is subsidizing those loans or guaranteeing those loans, essentially, they need to know, or they want to have assurance that those loans are going to be repaid in full. Yes, there are forgiveness programs and income-based repayment plans and things like that, but that's really not the ideal, not if you're trying to make it a sustainable endeavor to provide education or provide access to higher education to people who need it, right? Because essentially what's going to happen is you're going to have to keep dipping into that pot of funds, or expanding it in order to continue to provide the same level of funding. So it all comes down to, why in the world is really the question we should be asking. Why in the world are costs of education going up, relative incomes for allied health professions staying the same or sometimes going down, and what can we do about it? Those really should be the three questions that we're asking. Why is it going up? Why are we getting paid the same, if not less, than 20 years ago? And what can we do about it? So let's start with the first one. Why is the cost of education, or why has the cost of education climbed very high recently? Well, I would argue that if you look at it, it's probably related to, in no small part, I would argue, would be what we call moral hazard. And what do we mean by that? It means that if the person either receiving or paying for a good or service is not bearing the brunt of the cost, they spend it more freely, essentially. I know that there's somebody out there, an economist, who's going to give me a more technical definition, but that's basically it. If you don't see the price, or if you're not paying the price directly, either by deferring payments or by having it subsidized or whatever, you're going to consume more than you would if it was a truly limited resource or there was a direct cost to you, the buyer. So when the government subsidizes an unlimited or near unlimited amount of borrowing, a few predictable things happen. The first one would be that students borrow more than they normally would. And not only do they borrow more than they normally would, sometimes they are less judicious in the degrees or the career pathways that they choose to sink that money into. So, for example, and we'll talk about whether or not allied health is still a good investment. Let's say you're a student right now and you really want to get into healthcare, and maybe you don't want to go to medical school, maybe you don't want to go get one of these, what we'll call one of those quote unquote professional degrees, and you're looking at the allied health field, these graduate degrees. You know that you probably will get paid, let's say $80,000, $80,000 to $90,000 when you graduate from the program and get licensed and are able to practice. So that's your benchmark. You're going to make about 90. And you know that you've got to pay for 5 to 6 years of school, sometimes more, maybe 7 if it's like a DPT program where you need to do a 4-year undergrad and then 3 years in the program. So somewhere in the neighborhood of 5 to 7 years of tuition you're going to have to be responsible for. Do you care all that much about the degree field that you choose to go into if in your mind it's a healthcare field? Why do people go into healthcare? It's a safe, stable, secure job. There's always going to be sick people. That's what we've been told forever, right? No, odds are the loans are available. You can pay it back later. You're more likely to pull the trigger, so to speak, on a degree like DPT or OT or nursing or something like that, because the career pathways for those are relatively stable. You don't know very many PTs that are out of work or unemployed for long periods of time unless they're choosing to do that. So you're going to do it, right? It still seems like a good investment. Even as tuition continues to climb up, it doesn't matter because you're not hitting any federal loan limits. You're not hitting a limit of what you do qualify for. And you're going to get a job down the line that's going to pay, $90,000 when you graduate. That's great. What does that do for on the education side of things? Well, on the education side of things, they've got guaranteed money coming in, which means a couple things happen. Maybe they decide to build a new graduate allied health program building or something like that, and that costs a couple $1,000,000, and it's okay, we'll just fund it by raising tuition a little bit. It's subsidized, right? The students aren't paying for it. We'll bump up tuition in order to cover this new fancy building or new sim center or something like that. Not that those are bad. Sim centers are cool. And then what also happens is there's an incentive on the educators or the educational institutions side of things to lower admission standards or to make sure that people get into the program that they want to get into, right? I know that there's It's just incentives. I don't think any of it is like a conspiracy or people are trying to jack up tuition price. I think it's just human incentives, right? Like if there's a source of money that you know is not drying up anytime soon, you tap into it. You raise the price a little bit. People are still going to pay it. And I think ultimately that's what some of the subsidization has done, right? It has altered some of those pricing signals because the market demand hasn't shifted despite, inverting ROI for some of these programs. The tuition has gone up, and we already showed on an inflation adjusted basis, it's not as good of a deal as it was before, but we're paying more for it. But those pricing signals haven't hit the market yet because the loans have been subsidized or guaranteed on the student side and on the educator side, on the institution side. So if every seat, for example, in a program is filled with federally guaranteed dollars, rigor into admissions naturally slips, and you start we all remember those predatory OT, or at least I do, those predatory occupational therapy assistant programs that cropped up maybe 10 or 12 years ago. There were a bunch of them that popped up. I'm not going to throw any names out. And then they got sued by the Department of Education. They ended up having to shut down. They were for-profit entities that were getting subsidized, guaranteed tuition from students that were being admitted to programs that were that the programs knew, or maybe not knew, but that's why they were sued and that's why they lost, right? That's why they had to shut down. That there was a good chance that some of them, that a large number of those students were not going to be able to pass a national board exam or maintain certification or qualify for whatever kind of licensure, right? And they were predatory in that nature. They would get these people in, they'd charge them whatever for the student, for the tuition, and they'd be federally subsidized student loans. And then it's up to you if you pass or not, which is why a lot of the accreditation bodies for some of these health science programs now have like pass rates as a requirement or something that programs are judged on, right, to maintain accreditation or something like that. So that's a check. And that's a very egregious example, right? These fly-by-night programs that open up, charge a bunch of money, bring in students that they know can't pass or that probably would not have gotten into other programs, and then it's up to you. You got the degree from us. That's all we were providing you, right? But those things cause inflation of the tuition itself to keep climbing higher and higher, right? And this is not a problem just to the allied health professions or to sciences in general. This is just a basic principle of economics. If the money is free, students are going to buy or spend that money more frivolously, or buyers are going to spend that money more frivolously than if it was coming out of their own pocket. And then on the side of admissions and educators and educational institutions, there's less of an incentive to monitor the cost, the rising cost of delivering their service or degrees, because the money's coming in and students aren't saying no yet, right? And they don't have to say no because they haven't hit that spot of not being able to pay for it. And the tuition inflation is nuts crazy. I remember when I was a professor several years ago talking to students who were entering or going to enter the field for a master's degree in occupational therapy. Some of them in many cases had $115,000 of student debt, and they were going to graduate and make $70 or $80K first year. Which, $70,000 or $80,000 is not a small amount of money. It's not an insignificant amount of money. But the math isn't mathing anymore. The numbers just don't work out. Like I said, when we graduated years ago, $50,000 or $60,000 was a lot of student debt. And we all graduated making more. I think there's one student in my cohort of 45 that graduated making less their first year than the student loans that they had for all of their years leading up to it. And that person was OT was her second degree or her second career, and she was still paying off student loans from a previous degree, right? So from a standpoint of return on investment, it has been declining year over year as tuition has gotten higher and higher. Feel it when they graduate, and now they have these student loans. It's basically graduating with a mortgage before you even buy a house, right? So that's kind of where we're at. That's how we've gotten to this situation where the Department of Education is now looking at all of these professions that historically have yielded good return on investment for students and saying these people aren't going to be able to pay off their student loans. We got to start limiting how much we're going to guarantee. So that's the first question. Why is it so expensive? The next question that we need to ask is, why isn't the ROI there anymore? why hasn't salaries or remuneration for clinical services met that or kept up with that? Why hasn't it risen commensurably? Well, probably the main reason is because we're stuck in this fee-for-service model. Like I've said several times, I feel like I always get on a high horse about this or a soapbox, but if the only levers you have to pull for these insurance companies to cover their own costs are how much they're paying for services or what services they're going to pay for or the amount of services they pay for, there's automatic downward pricing pressure on providers. And there has been for years and decades. What that translates to, pricing pressure, downward pricing pressure to healthcare providers translates to lower salaries for clinicians. That's just what it means. If the company's getting paid less, they can't afford to keep paying you raises anymore. That's just the way it works. If we continue to receive 2%, 3% Medicare cuts, for example, year over year, you're not going to be able to provide a 5%, a 6%, or a 2% increase in salary to the clinicians. Again, the math doesn't work to do that. So it's a combination. It's this perfect storm of having kind of moral hazard on the education side, where tuition has continued to rise almost unchecked, combined with an economic model or a business model of healthcare, a predominant business model of healthcare, that has resulted in downward pricing pressure for decades, leading to lower top-line revenue, lower bottom-line revenue, increased ability of healthcare provider organizations to pay clinicians on an inflation-adjusted basis the same or similar or more than they were getting paid 20 years ago. So those are the two big, they're two sides of the same coin. That is why we're in the situation we're in. You have moral hazard or have had moral hazard leading to inflated tuition costs and overspend in degree programs. And then you have downward pricing pressure that is just limiting the ability of employers to pay clinicians more than they would be, or more than they were making years ago. So the question then becomes, we've answered, how have we gotten there? How is it so expensive? The other question was, why aren't we making any more? Why aren't clinicians making any more? Now, the third question is, what can we do about it? Well, unfortunately, you're trying to spend your way out of this. You can't, really. You can't just throw more money at these degree programs because that's obviously not been the issue. So while it might, in the short term, really limit the pipeline of future clinicians to put caps on student loan amounts for certain programs, in the long run, I would argue that it's probably going to yielding probably a healthier employer market down the line. It's going to be tight for the next 5 to 10 years while it all sorts itself out. But by allowing those market signals of price and demand, supply and demand, or cost and demand, whatever you want to say, to hit the borrowers or the buyers and the providers of that service, the degree mills or the academic programs, you end up leveling out the cost in a way that the ROI starts making sense. Because now if clinicians or potential clinicians need to look at their degree programs more critically, what you'll end up seeing, or at least this is what I'm assuming that the Department of Education is trying to do, what they'll end up doing is looking at the various degree programs and saying, is this worth it? Because 20 years ago, I would be making the same, if not more, than I'm making now in this degree program, but the cost has gone up 35%. Is that still a good decision for me? And in some cases, the answer is probably going to be no. And then what happens is you end up with a drying up of students in the pipeline for various degree programs. Now, that is a big issue that we need to solve as an industry. That's not like, yay, it'll sort itself out in 5 or 10 years. Because if you run out of nurses, that's a big problem, right? If you run out of physical therapists or occupational therapists, that's a big problem. If you run out of PAs, it's a huge problem. So it's not something that's like, well, we're gonna solve this problem on a policy standpoint and just let the dust settle. We do need to figure out how we end up filling a pipeline of students that will be eligible to sit for board examinations, to receive clinical licenses in this environment where we're trying to limit the amount of money that has to be expended for a degree, right? So maybe what we end up needing to do is, I know Larry Benz and them have just written some kind of article about, I can't remember what it was. I heard it on a podcast, like a 2-year degree program for DPT, taking it from 3 years to 2 years. So there are some creative solutions, and I don't have any solutions. I can't tell you how. I think moving towards away from fee-for-service reimbursement for healthcare is a big piece of that, because it means that the downward pricing pressure onto healthcare organizations potentially gets alleviated some, which means that they're able to pay more. Because there's two ways we could fix this, right? We could pay clinicians significantly more when they graduate, in which case the inflated cost is offset by what they're making. Or what we're probably going to need to do, in all honesty, is work on both, right? Decrease the amount that's getting paid for those degrees and increasing the amount they're going to get when they graduate and become licensed. But one of the big pressure release valves would be making sure, or finding a way for healthcare providers to become more profitable outside of a fee-for-service model, or replacing a fee-for-service model, or having some kind of value-based incentive program or structure or something like that, so that providers can pay clinicians more. That'll help, at least initially, on the ROI side of things. On the education side of things, maybe we do need to become more creative about degree pathways. I know that's becoming a huge deal. You know, some of the boards that I've sat on and things like that, where we're talking about, well, does it undermine the safety and potential safety of a clinician that is taking a quote-unquote non-traditional path to a certification or to a degree? Probably, and it needs to be something that is looked at with stakeholders from all various sides of the coin: regulators, policyholders, education, accreditors, and the like, to make sure that these degree pathways that are formed are not cutting off our nose to spite our face, right? We're not making it so that now it's cheap, but now these people are going to hurt people, or they're incompetent when they get into practice, right? They still need to be able to pass some sort of entry-level board examination for sure. I might be biased for that because I do sit on NBCOT's board, the National Board for Certification in Occupational Therapy. Certification is important. It does more, arguably, to protect the public good and public safety of licensed clinicians. Arguably, even state licensure does. So it's something that we need to make sure that is not bypassed, but it is something to be explored. And I know, like, on the coding computer science side of things, there was a school that got big, maybe 7-8 years ago. I don't know if they're still in operation now. It was like the Lambda School or Lambda College or something like that. But their value prop, essentially, to new students was, you come to us, it's free while you're in the program. You're going to get a job in your field within 90 days of graduation, or you don't pay anything. If you do get a degree or a job in your degree field within those 90 days, which is what we're trying to make you do, you pay us, it was a percentage of your income for a set number of years. And it was like tiered and scaled. And if you were going to go into this kind of program, it was going to be, 10 years. If you were going to go into this program, it was going to be 5 years. So they were like steps. And that's how it worked. It was a really pay for success type of degree program. I'm not saying that we can do that on the allied health side of things, but it's being done in other areas. It might be worth exploring in healthcare. So I feel like I've talked this to death. Hopefully it made sense. Really, I think what we need to understand is the underlying reason or the context for the change in what the federal government is willing to loan or subsidize for certain degree programs, and understanding that it is not a value judgment on that profession as a whole. It's really a numbers thing. And the questions we need to be asking are, why is it so expensive? Why are we not getting paid more than we were getting paid, or we're getting paid less now than we were getting paid 20 years ago? And what can we do about it? Those three questions, in my mind, are the questions that should be taking the forefront of the discussion, not whether or not we're going to beg the Department of Education to subsidize more loans for degree programs that are yielding decreased ROI. So that's it for me. If you like the show, head on over to iTunes, leave us a rating or review. Shoot me a question. I'd love to answer it. There's a form probably at www.betteroutcomes.show where you can send that question over, and happy to answer it, or even to schedule a call and chat about it. Until the next time, folks, be safe, be healthy. I will talk to you then.
Thanks for listening to another episode of the Better Outcomes Show with Rafi Salazar. This episode was brought to you by Strata PT. Strata PT is a single EMR platform and revenue cycle management service for physical, occupational, and speech therapy practices that helps you achieve a 99.99% reimbursement rate. If you'd like to learn more about Strata PT and see how their EMR and RCM works, head over to stratapt.com to book a demo.